That's the concept behind CareMessage. That's the reason why we have built this organization, is to empower people at FQHCs and health centers to be able to do more with less.
We oversee about 70 clinics statewide that serve 2.2 million patients every year. And the majority of our patients are Medicaid patients, underserved, definitely a lot of complex medical needs, and a whole host of social needs that can really undermine a patient's ability to take care of themselves, and also undermines a care team's ability to take care of the patient.
I mean, I think we all kind of know some of the big social needs, especially in New York City. As I mentioned, housing is a huge one, as well as food insecurity. I think some of the surprises that we've heard from our partners, perhaps for the people who work in the health centers, are not super surprising to you, but I think transportation is a huge one. And we were talking to some of our partners at Montefiore, and they were saying simply by having transportation available and being able to shuttle their patients back and forth, they were able to reduce their hospitalizations and ER visits by a substantial amount. So that was huge for us, and that's a solution that's tangible that hospitals can put into effect, and I think that was really compelling to us. I think the other one is often childcare. It's how do you figure out if you have an appointment, if you have to go talk to a certified diabetes educator, you have to go to kind of one of your classes. How do you figure out how to manage your kids, or can you bring them with you? So I think it's really about how do you navigate the complexities, kind of the little complexities that turn to huge complexities in patients' lives.
So looking at people's income, looking at people's opportunity for employment, looking at their housing status, looking at their relationships, what victims of domestic violence, are they safe in their homes? Do they feel comfortable? Because at the end of the day, everything that we do socially, everything that impacts our environment is going to have an outcome on our healthcare. And I'll never forget someone saying, a patient saying to me, I really don't care about taking my medicine because I don't know where I'm putting my head to sleep tonight, and I don't know where my next meal will come from. And if there was anything that resonated for me around social determinant of health, it was that.
So at Ryan, SDH data was always being collected at the macro level. We were getting income status, we were getting homeless status, but it was never really at the micro. So at the micro level, SDH is, if it's not asked, it's unaddressed. And in my role, and being able to develop a standardized way to capture this data, we're able to report about what it is that we need, what are our needs, what are our patients' needs, especially serving such an uninsured or underserved population.
The technology is there to be used and to expand our ability to communicate, but it's the education that's missing that we need to work on. It's educating patients and clients how this can optimally improve your health. And with the populations that we work with, we have to make sure we're building the right campaigns, that we're speaking the right language, that we're bringing about the information in a way that it's tangible for them to want to use it. And I think that's the biggest challenge.
And I think at Robinhood, we kind of view technology as potentially a really incredible opportunity to create low-cost, scalable models, and really the integration of kind of evidence-based traditional models with a tech component. So it's really about how do you meet the patient where they're at, and tech can be a really powerful tool.